So for attendees, please have a look at the bar at the bottom. Please, if you have any question, please feel free to drop your questions on the Q&A box. Yeah, and later on, we will have a poll where we'll ask you what course do you prefer to study so that we can send you more information about the course. So the reason why we are choosing these two subjects is because there's a growing high in demands throughout the globally as well as in Singapore and Malaysia. So to understand your own future path, feel free to ask any questions and we will pull your question up on the stage, yeah, for the panel speaker to actually answer your questions today. So don't be shy. If you are not comfortable to reveal your name, you can always put your question as anonymous. So before we start this session, just want to let you know that AACC Global is actually a university placement agency that specializes in overseas educations. And do follow us on our social media like Instagram and Facebook for more information about today's sessions and information relevant to the university. Yeah, so now it's 2:31. We have about 39 attendees now. And thank you for answering your preference. Okay, let me start. So today I have Miss Curtin Lee from Curtin University. So she'll be explaining about speech pathology, and I have Miss Elaine Koh from the University of Sydney, and she'll be sharing about physiotherapy. And I'm really keen to know, like, is physio really only all about massage, like how our Instagram reel show, right? So first, let me just ask Elaine. Elaine, could you please actually give us a brief introduction about physiotherapy and why do students want to should study physiotherapy?
Okay, thanks so much, Koo. Hi, everyone. I'm Elaine, and I'm the regional coordinator here within the Southeast Asia recruitment team at the University of Sydney. So thanks for having me here today, and I'll be happy to share more about physiotherapy with all of you. So as a start, physiotherapy itself is actually a clinical allied health profession aiming to rehabilitate and improve the physical well-being for patients with movement disorders. So it's not only all about pain. Yes, there's pain included, I believe. And your role will actually contribute significantly to the wider community back home. You will be able to learn to change the health landscape as well as working to improve health and well-being of individuals, your families, your communities worldwide. So I have actually a link that I'll be happy to put in the chat box. It's a bit about the discipline of physiotherapy itself, and later I'll go through with you the benefits of studying physiotherapy in general as well at Sydney University. Thank you.
Thank you, Elaine. And over to you, Corinne. Can you please explain, give us a brief introduction about speech pathology, as well as why I study speech pathology?
Sure, thanks. Can you guys hear me clearly?
Yes.
Yep,
yes,
okay. Thanks, Koo, and good afternoon to everyone, to all potential students or parents who have joined us. We appreciate your time on the Saturday afternoon that you are with us. So in order to know, what is speech pathology, maybe to start, we will look at what do speech pathologists do. So speech pathologists, what they do is they assess, they diagnose and treat communication and swallowing disorders. So that includes difficulty with speech, language, literacy, voice quality, and stuttering. Okay, so those communication impairments, they occur for various reasons. It could be due to developmental delays, learning and intellectual disability, autism, Parkinson's disease, dementia, and hearing loss, or any other problems really that affect language and speech. Okay. As a speech pathology, you work with different types of people with a wide range of clinical population. You can work with babies, with toddlers, with school-age kids, with teenagers, with adults, and on live care as well. So it gives you a lot of flexibility in who you work with, because speech pathology work across lifespan. Okay, so a couple of examples. So for example, if let's say, a speech pathologist could help with giving feeding advice to a mom whose baby have a cleft palate, okay, or in the kindergarten, it could be like, students who have one of the toddler or child who have a bit of a language delay, or they are not, it's quite difficult to understand them. Or it could be a primary school students who stutter. So what the speech pathologist will do is will help improve the communication skills to make them more fluent, and to look at those, to improve their communication and their fluency. And the speech pathology works also a lot in hospital, like to, with people who have stroke, or people have brain injury due to car accidents or fall, or it could be a cancer patient who have communication and swallowing problems because they have lost autonomy in their mouth. So it's a wide range. So what the speech pathology do is they come and assess, and then they diagnose what the communication problem is or the swallowing disorders, and then they come up with a treatment plan. So that's, in summary, what, a speech pathology does. So they don't teach English, they don't teach how to speak. There is a lot of things, myth about it when you look at the King's Speech, like a lot of movies. So a speech pathologist actually work really in a wide range of settings.
All right, thank you, Corinne. Thank you for you both for defining and explaining what's this program all about. Now, back to you, Elaine. Elaine, can you please let the audience know roughly what would the student be learning throughout the 4 years physiotherapy programs? And is there any clinical placements? So you can start explaining, and I might ask you some questions along the way.
Sure, no worries.
Do you have a slide that you would like to share?
Yeah, so maybe I'll start sharing my screen first. Do let me know if you're able to view it.
Yes, I can. You might want to go up. Yeah, it's good.
Okay, wonderful. So as a start, the course structure itself, it's not too complex. So we actually have bachelors in physio as well as masters for postgraduate students who wish to study physiotherapy. So you're right, 4 years would be for the bachelor's degree and 2 years for the master's. So itself, I guess what we can say would be students will basically learn how to assess, to diagnose, as well as to treat people with movement problems, okay, caused by maybe perhaps a wide variety of joint, muscle, and I guess nerve disorders. And they will also learn to manage a wide range of conditions, including neurological illnesses, movement disorders, sometimes in children, rehabilitation after injury, post-operative recovery, and I guess chronic conditions like asthma. Asthma, is pretty common in our communities as well. So this would be actually good for students who wish to actually learn more in that area. And students also learn to use drug-free techniques. I know most of us would, use and take Panadol, for example, whenever you have any form of pain in the body. But we actually allow students to learn drug-free techniques to help people avoid injuries and maintain a fit and healthy body with the state-of-the-art simulations that we have. So there's lots of practical experiences when you come and study with us. The course also includes work-integrated learning, which is basically integration between coursework and placement learning outcomes. So there's a significant amount of clinical and professional fieldwork opportunities for students like you, providing hands-on experience with real clients, our real partners in a supervised environment altogether. So as such, we do have, for example, mandatory work component, which is around 840 hours for master students and a total of 1,040 hours, which equates to about 40 hours per week, okay, for the bachelor studies. And it will be easily met as part of the award requirements for the course. So I guess moving on to clinical placements as the second part of your question, Koo. When you come and study at the University of Sydney, you will also undertake several hands-on clinical placements embedded in as part of your degree, okay? This will allow you as a student to gain real-world professional experience from our extensive network of clinical partners in the field. And basically, it will be more than classroom learning itself. the University of Sydney has the largest range of clinical placement partners in the whole of New South Wales. So if you're interested to study in New South Wales or in Sydney, I mean, this is definitely the place to come. You will get your exposure from here. And the placements at the Sydney School of Health Sciences, they are actually arranged and coordinated through our dedicated work integrated learning team. So they're there and they are responsible for high quality placements and simulated learning experiences for you, okay? Later, I'll also share the link in the chat box, a bit about our placements, so you can actually have a read after the session or even during this session today. But just remember to actually bookmark or click on the link. So in case the chat box disappears after today's webinar, you'll be able to save and bookmark the links altogether. So a bit more about the placements. They are located in Sydney metropolitan area. So that's in Sydney City itself. We also have placements in rural areas or outer Sydney, as well as private practices and community facilities. So all candidates will need to actually take at least one rural and regional placement, and you need to complete 5 practicum placements in 3 of the 4 5-week blocks, basically in semester 2 of your 3rd year, and 2 of the 4 5-week blocks in the 1st semester of your 4th year of your bachelor's degree. So our placements are actually more towards the end of your degree rather than the beginning. And especially now during COVID, this is actually really beneficial because students can study online, back in Malaysia, back in Singapore, back where you are, and when the borders are open, you'll be able to come over and continue your placements here in Australia. For examples, I've given you some names here called placement examples of our partners. The first one is PhysX. That's actually a primary healthcare setting where students focus to help determine diagnosis of injury and pain and working with clients to develop and implement a rehab program, okay? The second one would be Metro Rehab private hospital. So students experience inpatient and outpatient rehab in a private setting. The third option would be Fairfield Hospital. That's part of a government hospital. They are a key provider as part of the students' learning experience in a hospital setting. And finally, we have the Sydney Sports Medicine Centre, where students work on musculoskeletal problems arising from muscles and joints with athletes from numerous sports as well as general public patients. Thanks, Koo.
Thank you, Elaine. So you did mention that the program is clinical placement is actually done at a later year. So do they start at year 3?
Yes, so year 3 semester 2 and year 4 semester 1 onwards for us.
Okay, and roughly, do they do it as a subject, or is there an X number of hours they will do per week?
Yes, so it will be embedded as part of their coursework itself or subjects they need to take, and that would equate to the number of hours required for registration.
Okay, thank you, Elaine.
No.
Now I can see more people have come in since I first do a summary. So for those attendees who have just joined us, if you do have any questions, please feel free to drop your question on the Q&A box, and I'll get to those questions towards the end of the webinars. Yeah. So let's go on. So over to you, Corinne. So Corinne, can you please let us know roughly what will the students study in the speech pathology program at Curtin University, and also about clinical placement? Thank you. Corinne, you need to unmute.
Oops, yeah, now I'm unmuted. Okay, so I thought, like we look at speech pathology, like, maybe the first thing to know is how to become a speech pathologist. So to become a speech pathologist in Australia, you just need to have an accredited speech pathology course. And then you can literally, after you graduate, you become a member with the Speech Pathology Australia and you practice as a speech pathologist. So the courses that we're looking that are accredited, we have 2 courses at Curtin, the Bachelor of Science Speech Pathology Honours, which is a 4-year degree, and a Master of Speech Pathology. Okay, I'm not going to talk a bit about accreditation in other countries, but what I thought we look at the Bachelor of Science Speech Pathology, that's our undergraduate degree. Well, Curtin has been teaching speech pathology for a long time, about more than 40 years. So we have been teaching speech pathology and did quite a bit of research in this area. And also with speech pathology is an honors, embedded honors. So what it means is that every student that do our undergraduate degree will graduate and be awarded a Bachelor of Speech Pathology honors. So you don't need to do any extra year for the honors, or you don't need to apply for it, okay? So that is quite a big value proposition because it allows you to do a research project in the last year. And so if you want to do, for example, like let's say you go into research or academia, you can. Or also certain countries, if you have an honors degree, you are able to have a higher salary. And that's the case for the students in Singapore. Okay, so employers tend to, to give a bit more salary for our honors degree. So Bachelor of Speech Pathology is an embedded honors. So everyone who does that by speech pathology, will be graduated and awarded a Bachelor of Speech Pathology honors. Okay, we have a lot of innovative teaching method in our teachings, which probably I think later on we can talk a bit more about it. And in terms of clinical placement, it is mandatory in order to graduate. Students will need to do close to 950 hours. They will start in the year 2, where they have 15 hours, then year 3, 230, and the most chock-a-block will be in the last year. They will do around 700 hours. Okay, so just a quick looking at, the course curriculum, the course structure. The first year is what we call interprofessional year at Curtin. So every interprofessional year, interprofessional units are units that are done by all allied health. So they do 4 units. These are the 4 units that are on screen. And then the other 4 units that they do in the first year will be course specific. Okay, so that would be Introduction to Human Communication Science. They start to look into studies in language development. And then the second year, you start to look at introduce speech pathology practice. So that's where the 15 hours of clinical placement come into. And this is mainly observation, because in the second year, you still have a lot to learn. So it is an observation. And then you started looking at child language, clients with who help with stutter, neuroscience, assess adult language and speech. Okay. Then third year, that's where you have your first pediatric and clinical placement. All students will always have both clinical and pediatric placement. And then the 4th year, that's where the most block of full time. So literally you will have 700 hours. So you have both adult and pediatric settings. And that's also where you start doing your research project. Okay, so for clinical place, and the other course is a Master of Speech Pathology, just in case people are interested in it. So Master of Speech Pathology is essentially for students who have already a degree and want to become a speech pathologist. Okay, it could be that you want to course switch, you want to change career. That's the course that you're going to do in 2 years' time. In 2-year course, you can become a speech pathologist. So in terms of practical placement, they have about 735 hours, and all of this is done in the second year. Okay. Just a little bit, I can put that on the Q&A later. You can have all the information about the course structure. But just for you to know, if you're doing Master of Speech Pathology, we do start a bit earlier than the other course. It starts in January because it's literally 2 years. It's a very intense, condensed 4-year speech pathology into a 2-year master. So we do start earlier than the rest. Okay. And similar to then the second year, that's where you do all the clinical placement. And so in terms of clinical placement, all students will, both for undergraduate and postgraduate, they will do both at our clinic. Curtin has 2 clinics. So we have an adult speech pathology clinic, and we have also a stuttering treatment clinic, which is the largest in WA. Okay, so they will do both. They will go to one of our clinics, and also they would do community or schools or hospitals. So that's a little bit about the clinical placement. Okay, I'm just going to
Thank you, Corinne. I'll probably ask you the next question since you're here with me. Now, so students who have done their, because this is a professional program, so after they completed their bachelor degree or their master's program, they will need to seek professional body recognitions. And I do believe that there is a professional body in Singapore that governs that. But do you know whether is there any in Malaysia for the benefit of Malaysian audience and what for the Singaporean as well?
Sure. I think from what I understand for Malaysia, so if you do the speech pathology and you go home, there is no governing body that have specific registration, so you will be able to practice as a licensed speech pathologist once you go back home. Yeah.
Okay. Okay, then I'll come back to you the next question, but I'll ask Elaine first. So Elaine, thank you for waiting for us. So the next question to you is, since we know about the clinical placement start towards year 3 and year 4, and so after graduating with the physiotherapy degree or master's program, is there any governing body in Malaysia and Singapore for this course?
Okay, thanks so much, Koo. So I'll share some slides here in relations to being a physiotherapist, for example. So we have if you actually study in Australia and then you would like to actually register to be a physiotherapist here in Australia, basically you can either complete your bachelor, which is 4 years, or master degree, and that will lead you towards registering as a physiotherapist here in Australia. And in Australia, you can register with the PBA, which is the Physiotherapy Board of Australia, and that's overseen by APRA, which is Australian Health Practitioner Regulation Agency. And before you actually start your practice itself. But once you are successfully registered here in Australia, you will probably need to continue meeting your number of hours, and that's basically 20 hours of CPD, which is continuing professional development activities each year. And yes, in Singapore, our physiotherapist degree is accredited and recognized by Singapore Ministry of Health. There are some website links I can share with you. Would you like me to do that, Koo, now, or would you like me to move on to accreditation later?
On the chat box.
Sure.
Yeah.
Okay.
Yeah. Thank you.
So,
Yeah. So since when you're doing this, just want to ask you. So for a student to select University of Sydney for physiotherapy, can you please give us a few key highlights in terms of the facilities and the support that University of Sydney offer to students who are selecting this program?
Yes, sure. So basically, in terms of facilities and support, maybe I would like to show you a pretty picture here, and that would be our brand new building. Okay, so this has just been effectively this year. It was just open. All right, so this is actually our brand new Susan Wackel Health building. Previously, all health science students were actually off campus, not in the main CBD area. We were actually pretty much in, Cumberland campus, which is a bit of a distance from Sydney Centre. But all our allied health, so whether you're nursing, speech, physio, any health science students will be studying in the brand new Susan Wackel Health Building, which is in Camperdown, and that's our main campus itself. It has, I guess, what we call purpose-built laboratories, simulation spaces, a huge 350 lecture theatre, as well as a rehab gym. We also provide on-site health clinics, and that serves, research, teaching, industry, as well as community outreach as well. So I would say in general, it's a world-class research facilities available right in the main campus, and all students who are currently with us are really happy with, the outcome that they can belong to the main campus itself. Later in the chat box, I will share with you a link about, this new location or this new building facility for those of you who are interested. Support-wise, the Sydney School of Health Sciences, we are nationally and I guess internationally recognized for leadership and innovation, for example, in research, as well as teaching work integrated learning here in New South Wales. So our WIL team, that's the short form we call, basically it's there to help support students, in meeting their mandatory work component as part of the course requirement. So we understand that the programs are really highly competitive, whether it's in the bachelor's level or master's level. We do have a strict quota for each program, but we also have dedicated academic support team, okay, who will be there to give all our students a more tailored student experience. And this is actually why we are ranked #1 in Australia for graduate employability and 3rd in the world for sports, for physical therapy and rehab by the 2021 QS subject rankings. So this link here is a bit, I can actually paste that in the chat box later, but this basically will lead you to find out more about the facilities when you study physio here at USyd.
Wow.
Thanks.
Thank you, Elaine. Thank you for sharing the USVY Teacher Study Physio. Now, back to the same question, back to Corinne. Why do students, is there any key highlights that you would like to pinpoint out in terms of speech pathology at Curtin University?
Yeah, sure. Yeah, as I said, Curtin has, have taught speech pathology for more than 40 years. And our Faculty of Health Sciences is one of the largest and most comprehensive health schools in Australia. So we are very comprehensive, and also most of the graduates in WA actually for health sciences are actually Curtin graduates. Maybe what I can do is I'll share a little bit about the facilities that we have. So we use a lot of innovative learning technology. I'm just gonna show one slide. Probably visuals, for facilities, the best way is to probably show a visual rather than talk it over. Just give me a quick.
Yeah, we can see.
Yep. Okay, cool. So yeah, so one of the key signature probably facilities that we have for speech pathology is we do have what we call GMD Avatar. Okay, GMD Avatar was developed in 2014 by Curtin University, and it is a world first avatar for student training. And in 2014, we received an Innovation in Education Prize. It was all about the news in Australia here. So what we do with GMD Avatar, we use that with speech pathology, psychology, OT students, where we learn what they do is we do empathy simulator. So how it works is that students come in, and Jim, who is the avatar, the virtual person, he's an elderly Australian man with mild dementia. So students will then treat him as a patient, okay? So they will need to communicate, find what's the problem. And Jim has different responses. Sometimes he's very depressed, sometimes he's very angry, and sometimes he could be quite aggressive or very difficult. Sometimes he's charming too, okay? So what the students will do, they treat him as a patient, okay? And all these, the responses of Jim is obviously controlled by the clinic educator. So then the students will need to respond. If Jim come and say, I am so sad, or I am so angry, so that then the students, what they do is they learn communication, they learn empathy, they learn how to build patient rapport, which is very, very important for a speech pathology. In fact, for any allied health that involves clinical, empathy, communication is very important. So that's quite an innovative learning technology that we use at Curtin for students before they go into the clinical placement. Okay, so really when you come, we, as I say, we invest a lot in technology. And on the right side, you see this is what we call a 3D size virtual bodies, or an anatomized table. So this is used by all health sciences students because for one of the core unit, the interprofessional unit, human structure and function. So it's basically a virtual body. So students can click on it, cut, pinch, or dissect it. They learn about human biology. Okay, so we still use cadavers, but this is a very innovative way where we use technology, in teaching students. Okay, and then I talk already about all our clinics and all. So I think I think later on we'll talk a bit about the career prospect, because demand definitely exceeds supply in terms of speech pathologists in Australia. Okay.
Thank you, Corinne. Now we have covered the intro. We have covered the program content, and now we are going to move on to the most important part, which is what is the entry requirements. Now I'm going to pass this question to Elaine. Elaine, are you there? Okay, so I'd like to know, when it comes to speech pathology, when it comes to physiotherapy, is there any quota for international students who would like to study either undergraduate or postgraduate program? And is there any interview required or any special test required? Is there any prerequisite subject that they need to have before they actually apply for this course? So over to you, Elaine.
Yeah, sure. Thanks so much, Koo. Very, very valid question because we do have lots of students and parents as well asking the entry requirements. So in general, for University of Sydney, our international quota would be 2020, as what we say. So 20 for bachelor students and 20 for master students across each year, okay? In terms of interviews, we do not have any interviews required or any additional tests required for studying physio, both at bachelor, for bachelor's level, for master's level as well. In terms of prerequisites, what I can do is I will share with you maybe this slide for entry requirement. This makes it easier, I think, for everyone to be able to digest. So let's have a look. Okay, so here you can see I've actually created a table where, for Singapore Malaysian students, you would be taking at least one of this, form of curriculum. So for example, for bachelor students, we don't have mandatory prerequisites, okay, for this course. However, we have this thing called assumed knowledge, which means that we recommend that you have it, but it's not compulsory. Okay, there are bridging courses available for, for example, physics, chem, or mathematics, so that, students will not struggle in their studies. If they do not have any of these subjects prior, it's okay. You're still welcome to apply, but it would be encouraged, because most of the time when I do look at the applications of students from Singapore, Malaysia apply, they would actually have, they would be in that stream, okay, to apply to study with us. I think it's only a few cases where they may not have those subjects, but then again, it's not a prerequisite, it's just an assumed knowledge. So we'll be happy for you to actually apply, but you could also consider taking bridging courses prior to our program, so that you'll be, equivalent to the standard required when you come study with us. So the undergraduate table of direct entry requirements can be found here. Okay, take a screenshot, or we'll be happy to actually send you some information after this session today as well. We do require students not only to meet academic, but also the English language proficiency requirements too. So remember, there's no essay required, there's no interviews required, but if students who take, say, A-levels, whether it's the Cambridge A-levels or Singapore A-levels or even IB, the English component is waived for Sydney University. So applications are now open and it will close 31st of January next year. And this is for the 2022 intake. So each column would be an equivalent of an international ATAL of 97. That's the entry requirements for our Bachelor of Applied Science in Physiotherapy. And based on the 2021 arrangements, the timeline would be similar for 2022. If there are any changes, we'll definitely put that on the website. But as of now, status quo, we're more than happy for you to start applying. Thanks, Koo.
Thank you, Elaine. Corinne, over to you. Is there any quota for international for speech path? And is there an interview? And what's the prerequisite subject for this course?
Sure, let me just share my screen.
Yeah.
Okay, so in terms of quota for speech pathology, we don't have a quota per se. So at the moment we don't, but that doesn't mean that it won't change. Like physio, we used to not to have any quota, but now we do. But at the moment, we don't have any quota for both our bachelor degree for bachelor and master degree for our speech pathology. Okay, there is no interview as well. It's just you need to put an application. In terms of entry requirement for Bachelor of Speech Pathology Honours, you will need to have successfully completed a high school qualification. So it could be A-level, IB, OSMAT, STPM. And there is a cut-off score, so it depends on which qualification. So I'm happy to send that to ACC if you're interested. ACC can counsel you specifically in regards to your qualification. And the course do have a course prerequisite. You need to have a one science subject at year 12. Okay, so if you are doing A-level in Singapore, you do need to have a science subject at your H2 level. So we do need to have a science subject. In terms of English requirement, it is an IELTS 7.0 in all bands. But if you do A-level, if you do IB or SMAT, it will be waived. STPM as well. So it depends on which qualification. So if you don't have the required qualifications or the required grade, then you will need to do English requirement. And also, for those who have done a diploma, whether at Singapore Poly or a diploma in Malaysia, that you could also apply for it. You need to complete your diploma. It depends on which institution you're from. The GPA might vary, and also you still need to have a science subject. If you're looking at a Master of Speech Pathology, you will need to have completed a bachelor degree in any discipline, but we do require human biology. Okay, so for the students who have, a bachelor degree that is biology, but if you do have a course weighted average of a minimum of 65%, you can still apply because you can do your human biology online before you start the program. So we do have a list of approved units that you can do, either at Curtin or any other, some universities in Australia. It's all online. So as long as you have successfully passed your human biology, even though you come, let's say, from a business background, you could go into the Master of Speech Pathology. And we also have an English requirement, and the English requirement is 7.0 in all bands. And that can be waived as well, depending on which institution, which country you have done your bachelor degree.
Okay, thanks, Corinne. Now, I'm going to ask you the next question since you're with me. Now, what's the career path for a speech pathology? I know now with a lot of millennials, they would like to, work for on your own instead of attached to a company. Yep. So, can you please explain what are the opportunity for the graduates in this area?
Yep, sure.
Yeah, and if you have, if you know what's the starting salary, it would be great if you can share as well.
Sure. Well, in terms of career options, obviously, if you study speech pathology, you're looking at becoming a speech pathologist, or otherwise, if you wanted to research, you could go into PhD, Master of Philosophy, or academia. Speech pathology work in a lot of different settings. They could work, hospital or aged care facilities, in a lot of schools, like whether kindergarten, primary, high school. And is there opportunity for them to start their own business? Definitely. So a lot of speech pathologists do work for themselves. So they work either in private practice or they work for themselves. And especially in Australia, like, a lot, I do have quite a few friends personally who are speech pathologists, and because they are mom as well. So they work for their own and they are in control of how many hours they want to work and how many clients they want to take. So definitely, if you're interested to help people, okay, and you are entrepreneurial at the same time, definitely for speech pathology, you could open your own practice and run your own practice. That's definitely doable, and that's quite a common option, I'll say, like in Australia.
Mm. And do you know what's the starting salary range?
So for speech pathology in Australia, it would probably go from mid-$60,000 to 70. So so that would be the starting salary. On a median, so with experience will be about 100K.
100K. Okay, thank you. Thanks, Corinne. Now, Elaine, how about the career opportunity for physio? I know, like I myself, I'm a chiro patient, so I do whenever I meet my chiro, the next thing is I'm going to meet my physio as well. So can you please explain like what sort of career path and beside working with chiro, who do they work with actually?
Yeah, you're not alone, cool. Myself, I'm guilty of it as well. Especially as we, get older, we will be, using such services, I guess, moving forward. And career paths in general would be, as a start, I guess, physiotherapists, work in very diverse settings. So not only with chiro, they include, hospitals, healthcare organizations, private practice, sports settings, schools, universities, as well as research, as what Corinne mentioned earlier. So there's actually many ways to actually branch out to. And there is actually a range of career paths, including specialized clinical areas such as like sports medicines, pediatrics, orthopedics, musculoskeletal physiotherapy, even neurological physiotherapy for the brain, and cardiorespiratory physiotherapy, that's for the heart. So we have actually a career center at Sydney University that offers interchange programs. So interchange, allows students to actually develop entrepreneurial skills, like setting up your own business in the future. So for example, you can think about opening up your gym soon after graduation. And I actually have a link of one of our students who is studying physiotherapy and would like to actually branch out in opening his company. So I'll actually put that in the chat box here. It's a recent interview with one of our students. In terms of career expectations and salary range are pretty much similar to that of speech. You will earn between 65,000 per annum to around 71,000 per annum as a fresh graduate. Okay, starting salary also, I guess, differs state by state. And in terms of how much it can go, I think it's there's no ceiling to it. So especially towards private practice, it can actually go up sky high. So this University of Sydney does have a lot of assistance in terms of career fairs, and our dedicated team to actually help physio students meet their number of hours for clinical placements. All this will actually allow students to be able to, I guess, what you call be job ready after graduation.
Okay, so you did mention that students can actually specialize after their bachelor degree. And do those courses offered by University of Sydney as well?
That's right, yeah. So in terms of specialization, because when we actually Google search, for example, physiotherapist salary in Australia, there's different types of physiotherapists. So there's like physical therapy, there's rehab, there's pain management, even for elder care. So I guess, it just depends on, where your passion comes from and what areas would you like to specialize in. And definitely the university will be able to assist you to follow your passion altogether.
Okay, thank you. Now, this is towards the end of my Q&A with you, but there's a few more questions coming from the attendees. So my first questions will be to Corinne. Now, understand that the admission for Masters of Speech Pathology with Curtin University requires evidence of human biology studies. So if I do not have a relevant background, like if I'm a business student, so is there a bridging program for them to apply for this course?
Yeah, that's correct. So, well, it's an online unit that you can do. So you only need to show evidence that you have human biology at the tertiary level. So what you can do, because the course starts every January of every year, and the application will close end of October. So what you can do it at Curtin as what we call a not for degree. So you do it only online. Or we do have a list, like for example, we do have a list of other universities where you can do that, you can do online, and that is approved already by the school. Okay, so it doesn't matter if you come from a business background or design or any other allied health. Most of the other allied health do have human biology in their course. But if let's say you want to totally career change from business, from media, that's totally, you can do it as long as you do that human biology online. So yeah.
Okay, thank you,
Yeah.
Corinne. And Elaine, just want to ask you, what's the difference between physiotherapy and OT?
Yes, definitely. A lot of students may get confused between the two. Everyone wants to apply for physio, but I guess OT is actually a really good program, so they shouldn't be undervalued altogether. PT, physical therapy, physiotherapy, that's what we call it in short form, basically focuses on improving your movement, your mobility, and function. Okay, so physical therapists will do this with various forms of exercises, stretches, and physical activities altogether. So say, for example, someone who had a knee replacement surgery, they will visit your PT as part of their recovery process. So the physical therapist will work with the patient to strengthen their knee and increase the motion as well as their knee joint. So they can then move easily with less pain and discomfort without Panadol. Okay. OT, on the other hand, which is the occupational therapy, it focuses more on helping you perform your daily tasks easily. So this type of therapy, focuses on improving your fine and gross motor skills, so you can carry out day-to-day activities. The OT person will also focus on making, say, for example, your home or your school or your work environment more optimal for your daily life. So OT people could be someone, for example, recovering from stroke, okay? So this person will have to learn how to do or perform their daily tasks like dressing, eating, brushing your teeth, etc. And they will also help you make changes in the home, like installing, for example, a grab bar in the shower to make yourself, more easier in terms of functioning altogether.
Right. Thanks, Elena. There's another question for you. So, if the student have a diploma in physio, how many? So, is there any exemptions? So, I'm not too sure whether this student is from Malaysia or Singapore.
Yeah, that's right.
So, yeah. So, I think it will be on case-to-case basis, right?
Yeah, definitely. So for example, if your diploma is in relation to a Singapore Polytechnic diploma, we do have credit exemptions, or what we can place credits for students, and that will, see if, for example, if your diploma program is also in physio, you will probably get more credits. If it's, for example, diploma in business or accounting, and then moving on to Bachelor of Physio, there may be lesser credits. There could be, elective credits, for example, rather than course-specific credits. And we do have on our website, because we have, for example, 5 polytechnics also, we do have articulation with them, and I'll be happy to share with you the links later in the chat box, where you can actually search your diploma type from which institution, across our physiotherapy degrees altogether. So that provides a bit more of clarity for students who are thinking about transferring or moving towards the bachelor degree after completing their diploma from Singapore.
Okay, thanks, Elaine. I'll give you some time to put in the link. So I'll ask the next question to Corinne. Now, Corinne, what's the difference between pathology and speech pathology?
Between pathology
and speech pathology, there's a huge difference. Yeah.
Okay. Yeah. Well, I guess in terms of pathology, like it depends on what type of pathology you're looking at. Like, let's say if you do lab medicine, you're looking at diagnostic pathology. Okay. Where speech pathology is very much towards communication impairments. So communication in terms of your speech, your language, swallowing, or voice. So if, for example, like speech pathology can help teachers who constantly lose their voice. So what they help them to use their voice more effectively. So it's more, so speech pathology is very much focused on communication and swallowing. Yeah. So that's probably, the main focus. Yeah. Whereas,
yeah. Is there any institutions that you have credit articulations with in Singapore or in Malaysia?
Well, there's no speech pathology diploma in Singapore, so we won't have any other like straight what we call articulation or CRO assessment. But for Malaysia, as far as I know, it's I'm not sure whether they have any diploma in speech pathology, but in principle, if you have a diploma and you apply to the university, once whether we have had we have had application from this institution or not, we will do a mapping. Okay, so we do mapping and look at whether your units are mapped into our course curriculum. Sometimes you will be required to give your unit outlines for the course coordinator to make a more informed decision. But in principle, if you have a diploma, there is always the possibility of having credit exemption as long as the units map with our course structure.
Okay, thanks, Corinne. Now, Elaine, I have a few more questions for you.
Sure.
Now, so there's a question, if I graduate with a degree in physio from Australia, will my degree recognized in the US if I would like to work over there?
Yes, most definitely. So our bachelor degree or even the master's degree in physiotherapy, it's globally recognized. The curriculum, the transcript, and what I would like you to perhaps go further would be to find out the institutions that you're thinking about working at. For example, alternatively, when you come and study with us, and if you would like to have a student exchange experience, say in the US, we do offer that for physiotherapy students as well. So this might give you a bit of a head start to do that, one-on-one student exchange with our global partners in the USA, so that you can actually have a sampler taster, of what it's like studying there for one semester as an exchange student. And then if you decide to work later, you are still happy, to live and work in the US, you can definitely use our degree to actually seek employment there as well.
Okay, before I ask you the next question, just want to remind the attendee, we have about 7 minutes left. So if you have any question that you would like to ask, please put in your question on the Q&A box now. So Elaine, let's move on. So how do I apply for physio, and is there any admission cycle, or what's the admission procedure? So as I think from your slide, as long as they apply before the intake starts, that'll be all right, right? For physio.
Yes. So maybe what I'll do is, because earlier I mentioned about the bachelor's degree, the bachelor's program is already open, okay? And it will close 31st of January next year for the 2022 intake, all right? So as long as, you would have your final transcripts, your program, for example, if even though you are waiting maybe for your final results, you can still apply first, all right? For example, we do accept predicted scores for IB, for A level. So if you're considering that, you can start your application process. But once you do have your final transcripts or official results, you can then submit that later to finalize of your offer itself. But what I have not mentioned earlier would be the master's degree. So for master's, it's slightly different. Maybe what I can do is quickly, let's see, let me just share this with you right now. So for the master's program itself, slightly different, okay? Master's of Physiotherapy, the Faculty of Medicine and Health, actually, we have changed, all right, the assessment for 2022 onwards. It's already open right now, and we have moved to an assumed knowledge-based approach. So students do not require to provide any form of unit outlines any longer. Instead, you will just need to complete the assumed knowledge self-assessment form. I'll send you the link in the chat box later, and you can then just nominate the units, okay, which meets the assumed knowledge requirements. We only have 4. So it's human anatomy, human physiology, exercise physiology, as well as neuroscience. And for direct entry, you would need to have a minimum bachelor's degree of around 4.5 out of 7. That's about credit average. For Singapore students from, say, NUS or NTU, that would be around 3.3 out of 5 for your CGPA. In Malaysia, if you're from universities in Malaysia, that would be equivalent to about a second class upper, and that's roughly around 3 out of 4. So this is just the minimum requirement, but please note that the places for Masters of Physio is actually limited, and offers are made based on academic merit altogether, okay? So what I can do is also let you know that the applications will close 31st of October this year. It's slightly earlier than the bachelor degree program. So encourage students to actually consider, collating all their information there, for example, their transcripts, their English language proficiency requirements, and then, you can perhaps, make an appointment with the AACC counselors who will be able to assist you with the application process altogether.
Okay, thank you. Now, before I move on to the next questions, I just want to inform the attendees today that actually both universities do offer speech pathology and physio. So meaning University of Sydney do offer speech path and physio, And same goes to Curtin. They offer speech path and physio as well. Now, there's a question from Calvin whether we'll be sharing the slides. Now, we will be sharing key informations. We won't share the exact slides, but we will be sharing key information, especially the link that's shared by Elaine and the links shared by our counselor for Curtin University. We'll be sharing with you as well so that you can get more information. And our counselor will be in touch with you if you have any further information with regards to both programs and both university. Now, I'll move on to the next questions. Now, these questions will be I have a questions for Curtin. For Curtin Master's Program, which specific online biology course do you recommend?
Yes, it is a PDF attachment, so I don't think I can send it through the chat box for the Q&A. So what I'll do is that from Calvin? Was it? No, it was from
it's from Anonymous. So
Anonymous.
You can pass it to us. We can share with everyone.
That's what I was about to suggest, that I'll send you know, the list of the approved units. It's all hyperlinked. So you can just get it from AECC.
Yeah, we'll share it with you. All the Q&A we will compile and we will summarize and share with everyone who is attending today. Now, the other questions for both of you. Now, we know that border is closed at the moment. Is this course available online, be it undergraduate or postgraduates? Maybe Corinne can go first.
Yep, sure. Okay, so for the Bachelor and the Master of Speech Pathology, so I'm just letting you know from what happened for this intake. Both courses could be delivered online. Okay, I think as Ku mentioned, Curtin has physio as well. So we do have Bachelor of Science Physio and a Doctor of Physio, which is a master degree. So it's called Doctor of Physio, but it is a coursework. If you are from Singapore, it's recognized from it is recognized by AHPC. So for physio, only Singapore students can do it because not all units can be delivered online, but because in Singapore we have Curtin Singapore campus, so we are using these facilities for our Singapore students. Doctor of Physio is not available online. Yeah, but for speech pathology, both undergrad and postgraduate are fully delivered online, at least for the first semester. I think as for the first year unit, that can be delivered. And then obviously on the second year, that's when all the clinical placements and the labs come, then that's when it will need to be face-to-face learning.
All right, thank you, Corinne. How about you, Elaine? How about the both programs in Sydney? Is it available online?
Yeah, for Sydney University, yes. The faculty has actually shifted the entire curriculum when COVID actually hit us last year. So for the first semester, students who have already, for example, started online in 2021, this March, we started in March, it's actually available online right now. So students back in Singapore, in Malaysia, Vietnam, anywhere in the world, they are actually studying online. Remember what I mentioned earlier about the bachelor's course where the clinical placements are actually only available for third and fourth year. So that's why in the first 2 years, they can actually do the theory component online first. And then hopefully by third year and fourth year, the borders would have reopened by then, okay? And they will be able to come into Australia to continue on their practicum courses.
Yes, and okay, there's a student's inquiry, but I'm not too sure which one she's referring to. But since Elaine, you're with me, I'll probably ask you. She's a degree student and she would like to pursue another bachelor degree. So will she need to finish her A-level result alongside with her bachelor degree transcripts?
Right. So for this case, I'm assuming the student is not doing a Bachelor of Physio or Science related, maybe say, for example, a Bachelor of Business for that matter. Yes, more than happy for them to actually apply to study another Bachelor of Physiotherapy. I mean, should they decide to, perhaps they could include, just a short, paragraph about why they decide to actually take this path rather than, pursuing or continuing their, postgraduate degree in business, for example, or the course that they have actually studied for. Not necessarily to show A-level results, because we will actually focus on the latest qualification, that would be the Bachelor program itself. Yeah, and maybe after this session, if the student would like, to do, further consultation, or I can actually understand more about his or her intention of studying physiotherapy, we could actually, find out different pathways for her altogether. But in short, yes, she can apply, and no, not necessarily to show that, she has done her A-level results, but we could perhaps find out, that she has completed her A-levels, but we will not be basing on those A-level results itself.
Okay, so I don't, let me see whether is there any more questions. So I don't see there's any more questions coming in. Now, last questions, I know it's almost 1 hour. Last questions from me. Now, if I have a student, I got it from my counselor and the student couldn't make it. So students want to know, to save time, can they do physio with another program as a double degree? Have you seen a case like this, Elaine?
So physio double degree, meaning to say, give me an example, like, for example,
Maybe
in
physio and
Austria,
business or physio and psychology.
a combine altogether.
Yeah, double degree.
I believe it's doable, but physiotherapy itself is pretty demanding, I would say, in terms of, your research, your number of hours to research, and your number of hours for placements as well. Because we actually have a general science degree that you can combine, with, business as well as even law, for example. So you could do some component of allied health or health sciences as part of your science program, and part of your shared pool, you are able to do another major across the different faculties. So you can study some, a subject from, arts faculty, or, economics, for example, or even IT for that matter. But the Bachelor of Applied Science Physio, I would say, if students who are interested to study this course by itself, we would like the student to be able to focus on physiotherapy because of its curriculum. Okay, so it's pretty intensive course, and I've shared the handbook earlier. When you actually click on that and look under the course outline, the subjects that you'll be taking, the number of hours required, you'll be able to have a better judgment, I guess, if you would like to take on a second degree or another major altogether.
Okay, before I pass this question to Corinne, there's one question pop up, so just want to stay with me.
Sure.
So is there a way I can study human anatomy, physiology, etc., in order to enter master's program of physio in University of Sydney after completed in another degree? That means the students might not have a science-related degree, but would like to do a physiotherapy. Can they do take up subjects that is related to human anatomy and related, so that they can actually apply for the masters of physio? Yeah,
that's right. Yeah, so because we have now moved on to assume knowledge, if you would like to take on some extra subjects in relation to human anatomy, you can definitely do that as well. And all you need to do is to actually complete the assume knowledge self-assessment form. So as long as you can let us know how many units that you've done, whether externally or as part of your degree, once you complete that form, the faculty will be able to assist you from there in terms of recognition. So again, it's not a prerequisite, but it would be good for you to actually have some form of knowledge to meet the entry requirements, so that the faculty will be able to help you issue an offer letter at the end of the day.
Now, if the border remains closed, okay, so a student have accepted the offer into physiotherapy or speech pathology in Sydney University, and I know the program, some of these programs is quota program. So can they defer and secure that place in the next following year? That means if I accepted for February 2022 and the border did not open, okay, so can I defer my offer, this place to February 2023? Is it possible?
I'll go first. So for the bachelor's degree, students can study online. We're not saying that, it's not possible. So
if
for
they
those,
opt,
yeah,
if they
so
opt not to do online.
yeah, if they do not wish to study online and it's available online, we can't defer. What instead you will have to reapply for the next intake because it's quota based. Okay. However, second scenario, okay, if you do decide to accept the offer and study online for the first semester and decide, nah, it's not what you're after, or, for example, you would prefer to wait for the borders to reopen, we do have a deadline, which is census date, and that's usually around a month after you start your classes, okay? You can then suspend. So you've already enrolled, you already made the payment, but you can suspend without penalty if you do so before your census date. So students do not need to study the entire semester, but after this 3 weeks, for example, if they feel that they would not like to continue online studies, they will then suspend without penalty before census date. But if you decide to not even accept or enroll as a start, then for physio, because it's a quota course, you can't defer. You will be able to reapply again for the future intake.
Okay, thank you, Elaine. Now, Corinne, the same questions is over to you. Now, first question is, can the student do a double degree with, which, for example, speech path and psychology?
Yep. Okay. Well, I'm guessing that students looking at the double degree. That's what he's looking at. We don't have a combination speech pathology and psychology, or physio and psychology. I think, as Elaine has mentioned, certainly for physio and speech, and they are quite intense. So, and also accreditation purposes. So for accreditation purposes, students need to have a core foundation in academic knowledge and clinical placement in order for the course to be accredited. So there's no, so the only double degree I could think is a Bachelor of Science Psychology with marketing or human resource. But for speech, OT, pharmacy, it's not, because but what the student can do, I think, is to complete the degree and then do what we call the GEM, the Graduate Entry Masters. So that's where the Master of Speech Pathology come in, the Master of OT come in, Doctor of Physio. So those courses are essentially for students who have done a degree and want to career switch. Okay, so I think for that student, if you want to have two professions, you can, but you probably need to do it a step at a time. But there is always, but he can always do a master degree after that.
Okay, cool. Thanks. I believe so. It's quite taxing, to do or
it's pretty intense.
Quite intense. Okay, now same questions. If the border closed and the student have accepted their offer, can they defer to the following year because they doesn't want to do online?
Yep, they can. So I think there's two scenarios, whether they accept or they had an offer. So if, let's say, they have accepted their offer, and if even before starting a class, they decide that, I don't want to, we could have an early withdrawal, and we defer to the next available intake. So for most health sciences, there's only February. So they will need to come the February of the other year. So what we do is a variation of COE, so that, because obviously the start date of the course will differ. If, let's say, they have just an offer and they didn't, and similar to Elaine, the students have until census date to have a bit of a trial. So I always tell students, give it a trial. But if, after 3 weeks, or I think it's about 3 to 4 teaching week, and you have a sense of what online learning is, and if that's not your cup of tea, that's fine. You can withdraw, you do an early withdrawal before that, and then you defer to the next available intake. For courses that have quota, we will defer, but the student they need to know it is a first come, first served basis. So for physio, at the moment we have only 4 places left for next year. Okay, so we are only April. Yeah. So so it is first come, first serve. So you can differ, but if you differ, you need to accept. Yeah, so that you reserve, you confirm your place. Yeah.
So please do take note, there's only 4 more places left for Curtin Physiotherapy. Yeah. So yeah, so this is my last questions. No more questions. Yeah, thank you both for your time over the weekend, spending 1 hour with us, and thank you everyone that for your precious 1 hour on a Saturday afternoon. We do have, we'll be sending out details information about both programs from both university. Yeah, so I know Elaine has been sharing some of the links on the chat, and same goes to, we have been sharing some link about Curtin on the chat as well. If you didn't manage to copy, don't worry, we'll be sending to you. Yeah, so we can't send the slides to you like a full version, but we will take down the key information and compile into PDF and send it over across to you. So don't worry, this will be available to you probably by next week, end of next week, because we will need to send back and get both representative approval before we can actually send it out to you. So that will be the wrap up of today's sessions. And we actually have more health sciences webinars coming up in the coming weeks. So please go to our website and click on the courses that you are interested in. So there will be pharmacy, vet science, medicine, dentistry happening on the 27th and 29th of April. So please register. And before when we end this webinar, there will be survey pop up. So please feel free to let us know whether you are benefit from this webinar, or is there any area that we will need to improve. Please feel free to let us know. So thank you. Is there anything that you would like to summary, Corinne?
Yeah, I think one thing I forgot to mention, we do have scholarship as well. So, so if you're looking at applying, well, not for health sciences, because most health sciences courses start in February next year, but we do have scholarships. So for 2022 scholarship, it is in the process of being, we are in the process of confirming our scholarship scheme for 2022. So once that's confirmed, we'll let all our agents, so we'll let ACC, Malaysia and Singapore know. So just for you to know that there are scholarships for this year and next year as well. So, and if you do want to have a one-on-one session, if it's not only for speech pathology, but other allied health courses or other faculties, please do contact ACC, and we'll be more than happy to have a Zoom session, whichever medium that you want, whichever platform that you're more comfortable with. We're more than happy to have a chat with you.
Sure. Our counselor will be reaching out to everyone who has attended today's event. And if you wish to speak to Corinne or Elaine, please let them know so they can arrange one-to-one sessions for you at your convenient time, within office hour, of course. Elaine, is there anything you would like to say before we wrap up these sessions?
Well, I would say, I guess 2020 has been a challenging year for everyone, and 2021 we are, getting there, I would say. So just keep trying, your best. I understand that lots of students may be disrupted, in their studies throughout this pandemic itself, but we do factor into consideration, special considerations, as what we mentioned. So no harm, try your best, try for your scholarships, try for application. Most importantly, just follow your passion altogether. So if it's physio, speech, allied health, dentistry, medicine, whichever, do not let the pandemic stop your dreams, I would say. There are options available for many students out there, and this is across all Australian universities in general. So just make an appointment with ACC's team if you'd like to speak with myself or Corinne, and we'll be able to show you what we can offer in terms of an Australian education.
Right. Thank you, Elaine. And Elaine have shared the scholarship link on the chat as well. Same goes to Curtin University. We have shared the link as well. So feel free to click on the link before we actually end today's webinar. And once again, thank you, everyone. I'll be counting down to 5 and we'll be end the sessions. So 5, 4, 3, 2, 1. Have a nice evening. Thank you, everyone. Bye.